and welcome to BrainX here at Ramada Kelowna. Coming up, we're going to hear from some of the most inspired thinkers in the field as they share some powerful insights into brain injury.
So I'm just going to give you a quick history lesson. In terms of neuropsychology, in the past, and not the too distant past because I wasn't educated that long ago, but at that time, our focus was really on trying to understand where the lesion might be in the brain. And at that time, we didn't have the kinds of imaging opportunities that we have today with CTs, MRIs, functional MRIs, PET scans, diffuse and tensor imaging and such, which can much better ascertain where lesions are. So a lot of that time back in the late 70s, 80s and such was really focused on trying to understand the pattern of results that one gets to then delineate where the damage might be in the brain. Today, I think we would say, well, that doesn't really make a lot of sense because we do have these different investigative techniques that can more clearly appreciate where brain injuries are. So neuropsychology had to evolve, and necessarily so. And I think what we do today is hopefully adding much greater value than what was happening back then. But we do have to understand that back then, there were not the investigative measures to help various different professionals understand what had happened to the brain. So today, and I'll talk about this in more detail as we go through, but we look at the strengths and weaknesses, so those cognitive strengths that a person has, the challenges that they might experience. We look at the abilities to plan rehab, to chart that course for how people work through their recovery post-brain injury. Look at the direct and indirect consequences, and I'll deal with that a little bit more so when I talk about emotions, but suffice it to say, and I think both Keith and Carrie addressed this to some extent, that there are very direct consequences from a brain injury, but they're the secondary ones. And the secondary might be something like depression or appreciating what happens to your life after you have changes of the magnitude that occur. What are those kinds of consequences, and how do we understand those in the context of the injury itself? And we also, neuropsychologists and neuropsychological assessments are used as well in the sort of the independent neuropsychological evaluations to look at the effects of brain injury. And I know that Gary spoke very fondly of lawyers, but the idea of being involved in the medical legal kinds of evaluations. So neuropsychological assessments are used often for that purpose as well, and some of you may have experienced that as well. I guess the clicker is only so good as the person who actually controls it. So just to understand what a neuropsychological evaluation is. Luria, who is probably considered one of the preeminent neuropsychologists when he was alive, talked about neuropsychology and neuropsychological assessment as an investigation. It's an opportunity to understand that person and understand that injury in the context of that person. So it's not good enough to compare a person's results just to some normative data table and say you're impaired or not. It needs to be done with the appreciation of who that person is. So it's considered a neuropsychological investigation is probably an appropriate way to say it. So I've kind of coined it an NPI, not quite like CSI, but somewhat like that. So data collection is important. So what does that mean? Now, for most of you, you probably have the idea that a neuropsychological evaluation or assessment is simply a series of tests. And what I want to tell you is that's part of it, but it's one small part. There's much more that goes on beyond the actual testing. Tests are helpful, but they are not the be-all and end-all. Part of that neuropsychological assessment needs to involve a clinical interview. So really understanding that person as they relate their story to you. We need to understand from collateral, so their family members, significant others, that can help us to appreciate who that person is today, how they might be different from where they were before this happened. We review the documents, and sometimes there's a plethora of documentation. We may have boxes of information to review, versus other times it may be a simple one page, and sometimes it's restricted to a one line, please see patient. So documentation, though, is very important to consider because in that sense, did this move forward? There, thank you. Okay. In this whole context of appreciating who who this person is, we need to understand how that data that we collect relates to each other, so that the informational relationships. So documentation will tell us what happened to that person. The individual will tell us how that experience was for them. Collateral interviews will help us. The actual tests that we do will give us another piece of information. We need to understand whether that hangs together, whether it's congruent or discongruent. If it doesn't come together, we need to understand why. And so I'm going to just talk really briefly about traumatic brain injury. And I know that Carrie and Keith talked about concussions, but my preference is to call it what it is, and it's a brain injury. But the important point here is that not all brain injuries cause the same effects for each individual. And when we look at the very mild, there's certainly research based there, and we need to understand that when people are presenting with certain symptoms or problems, if it is consistent with what we know happened to that person. So a neuropsychological evaluation can help us appreciate why these particular issues exist, and it may be as a direct consequence of that brain injury, but it might be something else, and we also need to understand that, and so be able to put it into context. So that informational relationship is important. It's not good enough to just simply test somebody. We need to go quite a bit beyond that. So in terms of the assessment in total, and again, I want to reiterate, it's the document review, it's the clinical and collateral interviews, it's the testing itself, and then bringing that all together. We need to, and it's imperative that we understand not just the impairments, not just the deficits, but what are the spared abilities? What strengths does this person still have? Because in some respects, that may be more important in terms of helping that individual to move beyond the challenges that they have. We need to be able to relate those abilities to real-world issues. So this is an interesting challenge that I have with students often, in that they will look at the data and they will look at what's supposed to happen, where the scores are supposed to lie. And for those of us who are getting older, in some ways we're very fortunate when we see a neuropsychologist, because we get age credits. So you can have the same score as somebody who maybe is 25, and so if you're 65, your performance looks normal, and the person who's 25 looks quite impaired. And that's just simply because of the normative data. But let me ask you this. If the question is, can this person return to driving? So we're looking at a real-world task now. Are there certain levels of ability in terms of attention and concentration, processing speed, perceptual ability, and judgment, never mind emotional control or discontrol, that might be important with respect to that basic ability of driving? And I think most of us would say yes. So it may very well be that relating back a normative score that says that the individual actually performed at a level commensurate with that person's age, that may no longer be sufficient for that task of driving. That we may need to get beyond the normative values and say, what do you actually need to be able to drive? So that's just one small example. And the reason that that's important is that when you consider an ability, it's in the context of what's going on for that individual. Because also remember that in a neuropsychological assessment, it's done in a very pristine environment. So there are few distractions. So we get to an understanding of what they can do maybe in optimal levels, but we need to then take that information and translate it into real world. How does this impact on this person? Can they still pay attention when there are multiple things coming at them? So really relating it back to real world issues. It's not good enough to just simply respond to what the data says from a normative perspective, but to, most importantly, put it in the context of everything else that's going on for that person and everything that you have gleaned about that individual. And that really comes back to that ecological validity. So if it doesn't make sense, if it doesn't seem to hang together from the standpoint of that person's life, then you really have done a disservice to that person. So we also need to understand what's happening after the injury, after we do the assessment with respect to the individual's mental health, their physical health, just appreciating their support systems. All of that needs to be taken into account when we look at writing a report or putting together a report or a synopsis on how this injury has impacted this particular individual. Yeah. So in the evaluation, we are looking at a number of different factors. So we're looking at cognition. We're trying to understand emotion, personality, behavior. The latter three sometimes hang together, but they certainly have some differences as well. In cognition, when we look at that, we're looking at perceptual abilities, intellectual function, learning and memory capacity, the ability to pay attention, to focus, to sustain and divide your attention. We're looking at problem solving, the ability to make decisions. And we look at ultimately how those all come together, because assessing abilities in isolation may produce quite a different effect than when you bring it into the context of what has to happen. And I think most of us appreciate that when you undertake a task, it isn't one ability, it's all these abilities. But we have to understand how they relate to each other. So if I just take us to a particular, wow, I'm just about to use up my time. If we look at one particular ability, and I'll just talk about memory for a minute, because that seems to be a very common one. So when we look at memory, we don't just ask, can this person remember something or not? We want to know if they have a problem with what we call working memory, the ability to hold information in mind. Is it a problem with that verbal learning or visual learning? Is it that they have difficulty with longer-term memory? Is it remote issues that they have challenges with? If we look at perceptual, is it auditory or visual? We can look at it that way. And that's important to us, because if a person has a spared area, so let's say their visual memory works well, but their auditory doesn't, can we use that to help them compensate? There are stages and processes of memory where we look at, is it an issue with encoding? Do they have trouble getting the information in the first place? Or is it they get it, but they can't bring it back out? Is there a storage issue? Is it a retrieval problem? And so on. So there are a number of different facets to understanding a cognitive ability. And recall just simply refers to whether it's free recall, because I think everybody in here knows that if you're asked to recall something without any cues, tends to be a more difficult challenge. Do some people benefit if you give them a cue? Can they then recall better? So there are different ways that we look at every ability. So it's not just simply asking somebody or testing memory per se, but the various facets and the different abilities, sub-abilities that are there to help with the ability to remember. So if I just touch on the emotion, personality, and behavior, because I realize my time is getting short. The emotion, you can have direct and indirect consequences. So a brain injury can result in depression, in anxiety issues, in problems with impulse control, difficulties with anger, frustration, irritability. Those can be direct consequences of the injury of the brain, but they can also be secondary. So think about it in this way. If a person has impaired cognition, so they have trouble with their thinking abilities, it may interfere with their ability to cope. So their ability to cope with the various different challenges may also lead to depression, may also lead to some of those anxiety, anger control issues. So we need to understand whether it's direct or indirect. And at the end of the day, understanding these various different abilities, the cognitive abilities, their emotional control, discontrol, also helps us to direct treatment. Because the bottom line is that assessment drives treatment. You don't treat without assessment. And you don't treat without assessment, because if you don't know what you're treating, how do you treat? So the neuropsychological assessment provides a very good appreciation of what's happened to that individual in a very comprehensive way so that you can direct treatment appropriately. Let's go through this list really quickly. So there are a number of reasons why we do neuropsychological assessments. Diagnostically, maybe a little bit less so, because we certainly don't need to be trying to figure out if it's a right parietal lesion or a subcortical infarct or things like that anymore. But from a diagnostic standpoint, it helps in understanding whether a person has had a traumatic brain injury or not, or are there other issues. So traumatic brain injury, by and of itself, has certain symptoms, but those same symptoms can be consistent with other types of disorders. So appreciating whether or not it's a TBI or something else. We often get asked to consider whether it's dementia versus depression. And those are quite different issues, and treatment would be quite different as well. In terms of capability, often asked to comment on whether this person can make a decision about whether they can live on their own, whether they can return to work, returning to school, being able to provide an informed opinion about power of attorney. So there are a lot of issues with capability. We've talked about rehabilitation planning, but neuropsych assessments help to design rehab plans. Functional potential, trying to appreciate whether a person is going to get back to a certain level. How close will they get back to where they were before? Can they drive? Can they get back to school? Can they return to work? Can they live on their own? And what would it look like in terms of helping individuals to get to that level? Recovery trajectory, we're often asked this. So we'll see patients with dementia and wanting to know what their progression is. What does it look like? Are they actually declining? Is it stable? Is it not? And then helping to intervene appropriately. Serial neuropsychological evaluations, and I'll speak to perhaps what Carrie and Keith spoke of. We often will see players who are referred to us, whether it's through the UBC athletic teams or the local hockey teams, and asked, can this person return to play? And so we'll do an assessment. And the most recently, we saw a player who had a really quite significant traumatic brain injury and had some subsequent consequences from that as well. And when we saw him, we clearly indicated he was not ready to play. His attentional abilities were markedly impaired, processing speed was severely deficient. He wanted to go back to play, but fortunately, he was willing to listen and stayed out. We kept him out a month and re-evaled, and his performance had changed markedly, and we were able to then argue that it was realistic to return to play, and he went on to finish the season very well. Had he gone back when he wanted to, I think that would have been deleterious, and I do think that the neuropsychological evaluation helped all those involved to appreciate that there were some ongoing issues that were not readily apparent, because he certainly spoke very well. Okay, so I'm just going to tie up by talking about what we're doing currently in terms of our own work. So we are, at this point in time, doing research with memory. So we're looking to develop better ways to assess memory. And so we've published 2 papers, one in stroke and one in traumatic brain injury, on the assessment of memory, and helping to understand memory in a way that there are some measures that are not very sensitive. And we think we have much better measures now, and we're able to show that through research. And I think Kerry addressed this a bit, and he talked about the evidence, and it's important to follow the evidence. And so we're actually trying to do that when we look at our own lab and research. Neglect is another condition that many of you won't be as familiar with, but it's a condition where you don't attend to a particular aspect of your environment. Often referred to as inattention to the left side or neglect, happens more often after stroke. And we've done some, what I consider, seminal research in this area where we've looked at new measures to determine why individuals don't attend to that side of space. And if you want to consider 2 major barriers to independent living, one is lack of insight and judgment, and the other is neglect or inattention to one side of space. And you can imagine how that will interfere with your day-to-day life if all you see is what exists on the right side and you don't attend to the left side. So some of our work has been very helpful there. Emotional function and cognition. This has been a long-studied area, but what we're really trying to show is how much emotion can interfere with cognition. So it's not getting away from the fact that brain injury certainly causes cognitive difficulties, but when you add on the emotional component, so if somebody's depressed, anxious, has a lot of irritability and frustration, you can imagine how that will impact on your cognitive function. So able to demonstrate some of that. The last video. We've looked at new directions to assess, do neuropsychological assessments. It's not always easy for people to come in and spend 6 or 7 hours with us. So we've started to look at remote assessments, doing it by video. And I realize I'm way over. Be able to do it through video conferencing. So we've done the comprehensive clinical interviews that way. I will have a technician, a testing technician of mine somewhere remote, and they will then administer the assessment while I can still conduct the clinical interview, feedback and such at a remote distance. And I'm getting these really awful looks, so I think I better stop here. So even I can take a cue. So thank you very much. It's really a pleasure. Thank you.
That's all from us here at the Brain X Symposium. If you'd like more information on any of today's topics, you can head over to Brain Trust Canada's website. I'm your host, Lucy Hazelwood. Until next time, this is Shore TV.